With the end of the pandemic in reach, cosmetic surgeons say they've never been busier. They call it the Zoom effect. So what types of changes are people looking to make to their appearance, and what are their options? I spoke with Dr. Timothy Jochen, the founder of Contour Dermatology and Cosmetic Center, which has 3 locations throughout the valley. Dr. Jochen, first off, let me ask you, what are you seeing right now in terms of demand for cosmetic surgeries?
There's really been an explosion in the demand for cosmetic surgery right now. And I think part of it might be the built up demand because we were quarantined for so long. So people have wanted to do things, but there are other factors as well.
Well, what type of procedures are people coming in for? Is it mostly weight loss or facial?
Well, there's been a couple things that have happened. First of all, the quarantine 15 is a phenomenon and it's real. Some of my patients kind of are unrecognizable because they've gained so much weight. And so some are actually coming in wanting to get liposuction or cool sculpt or something to trim them down a little bit. But also, because of the Zoom, everybody's on Zoom and they're looking at their faces more than they're watching the rest of the meeting. And so they're not liking what they're seeing. So, we see a lot of fillers, people wanting to do lasers to get rid of brown spots, things to get rid of wrinkles. So people are talking about their eyes. So it's pretty much across the board, everything.
I'm curious, are you seeing people coming into your office who maybe before the pandemic weren't necessarily interested in getting cosmetic surgery, but now they are interested because obviously, like you said, things have changed since the pandemic
Yes.
began?
Yeah, exactly. So I do really believe in the Zoom effect. I mean, they talk about it, there are articles written about it, and people are shocked with the way they look. And, so people are really coming in because they have looked at themselves for a year on Zoom and they didn't like what they saw. So they want little tweaks and they want to look a little bit younger, a little bit fresher. And the other thing that's going on too is because of the mask effect as well, people could hide, their procedures because usually you have to suffer with a little bit of downtime. But with a mask, people are able to hide what they've had done. So they're kind of liking that as well.
Oh, interesting. Okay. So somebody may have had work done, but you won't necessarily know because it's hidden beneath a face covering. I
Exactly.
There are
Exactly.
different kinds of procedures, obviously. Not everything is under the knife, correct? You mentioned cool sculpting.
Sure. Well, we have a lot of non-invasive or minimally invasive treatments now, and those are devices that we have. We have radio frequency devices. We have cooling devices to get rid of fat. So wrinkles, brown spots, there are all kinds of things that you can do that are minimally invasive, as well as plumping and relaxing, with the fillers and Botox.
Safe to say that you've never been busier?
Without a doubt. Without a doubt. Thank God.
Yeah, that's a good. This is probably one of the few industries that has actually benefited from this pandemic. Cosmetic surgery.
Absolutely, absolutely. And one thing I found too is I've had a lot more young women come in, and I think some of them were spending their stimulus check on getting cosmetic procedures because I had a whole different demographic of really young girls coming in. We always have a few, but there was a big rush of them coming in to get lips done. That's the big thing for young girls,
So
or young
widespread.
women, excuse me.
Fantastic. All right. Well, Dr. Joshin, we appreciate your time. Glad to hear that things are going well. Thanks for joining us.
Thank you so much.